This surgical procedure is called cystotomy. Cystotomy is the surgical incision into the urinary bladder. For the patient signalment, our patient's name is Moningning, feline, breed Puspin, 1-year-old, male, 2.5 kilograms with a color markings of orange. Indications. First, facilitate removal of bladder and urethral stones. Strovite and calcium oxalate are the most common calculi in dogs and cats. Next, repair of bladder trauma, which is most commonly caused by blunt force trauma to the abdominal cavity. Identification, biopsy, and resection of masses. Papillomas and leiomyomas are the most common benign tumors, while transitional cell carcinoma and squamous cell carcinoma are the most common malignant tumors. Repair of ectopic ureters, which are the ureters that does not connect properly to the bladder and drains somewhere outside of the bladder. Next, evaluation of UTI resistant to treatment. Surgical anatomy. The location of the bladder lies primarily within the pelvic cavity, divided into the trigone, which connects it to the urethra and the body. Its blood supply are cranial and caudal vesical arteries, while its innervation are hypogastric nerves, whereas parasympathetic innervation is via the pelvic nerve. Its main function is to store urine that it receives from the kidney through the ureters. For the preoperative management, first, the operating room and table were aseptically cleansed. Instruments, towels, drapes, scrubs were autoclaved for sterilization a day before. For the patient preparation, the patient underwent fasting for 8 to 12 hours before the surgery. Defecation and urination were also encouraged. The patient was bathed and matted or soiled hair were removed. Vital signs of the patients were recorded. Pre-anesthetics such as atropine sulfate were administered, and then 10 to 15 minutes later, Zolotil, which is the general anesthetic, was also administered. The operative side, which is the xiphoid to pubis, were clipped and cleansed. The surgical team also prepared before transferring the animal to the operating room.
For operative technique, we expose the bladder by making an incision caudal to the umbilicus, and we use 3 fingers to measure where we will start the incision. After incising the skin, we expose the linea alba and made an stab incision to enter the abdominal cavity. We located for the bladder and isolated it from the rest of the abdominal cavity by placing moistened laparotomy pads beneath it. Due to the presence of urine inside the bladder, we performed cystocentesis, which is the insertion of needle or syringe to aspirate the urine inside. Next, we place stay suture on the bladder and its apex and trigone to facilitate manipulation. After which we made a longitudinal incision on the dorsal body of the bladder. We checked for the presence of uroliths and for any abnormalities inside the bladder, and after which we closed the bladder into layer closure. We sutured the submuscular layers with 2 continuous inverting suture patterns, which are the simple continuous pattern and Cushing pattern. After the surgery, the operative site were cleansed with povidone iodine. The cat were monitored directly until fully awake, and we also monitored for the presence of pain. We positioned the animal in a clean and comfortable area. Immediately after the surgery, we also administered antibiotic and analgesic. For its take-home medications, we have antibiotic, which is the cephalexin, given twice a day for 7 days orally, and the analgesic, meloxicam, once a day for 7 days orally. The suture was removed when the wound was fully healed. So these are the pictures of the wound. For the second picture, it's days after the surgery. And for the third picture, 3 weeks after the surgery. The skin wound was fully healed. Complications. We have transient hematuria and dysuria, post-operative infection if the operative site were not cleansed, urine leakage leading to uroabdomen, the presence of urine in the abdomen, wound dehiscence, and the incomplete removal of uroliths. Computations for the atropine administered before the surgery, we have 0.01 ml administered subcutaneously, Zolitil or general anesthetics. We have 0.5 as its full dose and 0.25 as its half dose given intramuscularly. For the take-home medications, we have cephalexin, 2.5 ml given orally, and the meloxicam, which has the initial dose of 0.2 ml, and for the next days it was given orally with 1.1 ml. For the fluid, we use D5, 162 ml, the maintenance replacement of 75 ml, total fluid of 237 ml, and the drip rate.